Monetary fund policies have only made matters worse. Researchers from Cambridge University say impoverished nations in the region have been forced to slash public spending for years to qualify for IMF loans, and that's left their healthcare systems in a state of disrepair and totally unable to tackle the ongoing epidemic. The IMF, however, insists the claims in the study are untrue and that its actions have been misrepresented. The head of the international lender, Christine Lagarde, has been bombarded by questions over its policies.
What will the IMF do to assist Liberia?
We cannot cure people. We cannot finance hospitals. We cannot send doctors, which is what is most needed. But it's for others to do that. And I'm delighted that the World Bank is doing its fair bit as well. We are in the business of providing financial support to states in needs.
Well, the IMF did provide a total of $130 million to the states most in need, but with the epidemic predicted to continue through the coming year, the assistance won't be enough to bolster local healthcare systems. And one of the reasons why hospitals in West Africa are short of cash is pressure from the IMF, as Professor Lawrence King, one of the authors of the report, explains.
Ebola outbreak certainly wasn't caused by IMF programs, but one of the major factors in the outbreak was the weak health system. We're not blaming the IMF for the Ebola outbreak. The point that we're making is that the IMF contributed to the Ebola outbreak and to the weak response to the outbreak. They did this in several ways. In order to qualify for an IMF loan, countries have to agree to do certain things. These are referred to as conditionalities, kind of free market fundamentalist policies which don't work very well with healthcare or with medicine. So this has led in these countries to have very weak medical systems.